Welcome to Fencing Buddies podcast. I'm Alex, and with me, as always, is Sarah. Today we're diving into a really interesting piece of original research, Injury Patterns in Fencing Athletes, a retrospective review, by Cross et al., published in the International Journal of Sports Physical Therapy. This one hits close to home for coaches and fencers alike.
Thanks, Alex. This article immediately caught my attention because it's a detailed, medically focused look at injuries in our sport, especially among younger athletes, which we often don't get. It helps us move beyond anecdotal evidence and really understand what's going on with our fencers' bodies.
Exactly. And right off the bat, the numbers jump out. 73% of injuries were in the lower extremity, with nearly half of those being the knee. That doesn't surprise me at all, honestly. As a foil fencer, I spent half my life lunging. But what does extensor mechanism dysfunction, primarily patellofemoral pain, actually mean for a fencer?
That's a great question, Alex. Patellofemoral pain, or runner's knee as it's sometimes called, is essentially pain around or behind the kneecap. In fencing, it's often an overuse injury that stems from the repetitive, explosive movements, lunges, advances, retreats, stops, starts. The extensor mechanism is made up of your quadriceps muscle, the patella, and the patellar tendon, which all work together to straighten the knee. When there's dysfunction, it means these components aren't working harmoniously, leading to irritation and pain. It's that constant eccentric loading when you lunge and recover, or absorb impact from a stop, that puts a lot of strain on that area.
So it's not like an ACL tear, which is what most people might think of with a knee injury. It's more of a chronic wear and tear situation. How much of this is technique versus just the sheer volume of training?
It's likely a combination, Alex. The article notes that a vast majority, 79%, were chronic/overuse injuries. That points directly to training volume and repetitive stress. However, poor lunge mechanics, say, the knee collapsing inwards, or not tracking properly over the foot, can absolutely exacerbate these issues by placing undue stress on the patellofemoral joint. So, technique feedback during training, making sure they're not just lunging fast but lunging well, is crucial. And strength and conditioning that focuses on glute and quad strength, along with hip mobility, can build resilience.
That's interesting. I also noticed the findings on hand dominance. Almost all upper extremity injuries were on the dominant side, and 70% of lower extremity injuries too. That's a strong correlation. Does that just confirm what we intuitively know about the asymmetrical nature of fencing?
Exactly. It confirms the obvious but also quantifies it. Your dominant hand is holding the weapon, so shoulder, wrist, and hand injuries on that side make perfect sense. And for the lower body, the dominant leg is your lunge leg, which takes the brunt of the propulsive and braking forces. The article specifically mentioned hamstring injuries were more frequent on the dominant side, which aligns perfectly with the explosive acceleration and deceleration demands of a lunge. It's fascinating how the body adapts to that asymmetry, but it also highlights where we need to focus our preventative efforts.
Speaking of prevention, something that really caught my eye was the mention of spondylolysis. Back pain, sure, I get that. But spondylolysis, that's a stress fracture in the vertebrae. They say it hasn't been commonly described in fencers. That's a surprise. What's the thinking there? Hyperextension or rotation?
That was definitely a novel finding. The authors hypothesize it could be due to repetitive extension of the back during lunge recovery, or rotation of the torso to avoid a hit. While fencing doesn't emphasize these motions in the same way gymnastics or diving might, the cumulative effect of hundreds of lunges with even slight hyperextension, especially if core strength isn't adequate, could certainly contribute. It reminds us that core stability is paramount, not just for power, but for spinal health too.
That's a fantastic point, especially with youth athletes who are still growing. The article also touches on age differences, noting that younger fencers, under 13, had more lower extremity injuries, but returned to play earlier. While older fencers, 13 plus, had more hamstring injuries. Any thoughts on why that might be?
Their faster return to play might be due to their inherent resilience, and the fact that younger bodies often recover more quickly. For older fencers with fully developed musculature, explosive movements put greater strain on the hamstrings for power and control. It suggests different age groups might benefit from slightly different injury prevention strategies.
And the sex differences, or lack thereof for specific knee injuries. The article says no significant difference between sexes for common lower extremity diagnoses, despite what we often hear about female athletes and ACL injuries in other sports. That's good news, but also kind of counterintuitive, right?
It is counterintuitive in a broad sports context, Alex, and the authors point that out. But it's important to remember they're looking at specific fencing injuries, predominantly patellofemoral pain. While female athletes might generally have a higher risk of ACL tears in sports involving jumping and landing, this study suggests that the specific biomechanical demands of fencing, which are more about lateral movement and controlled lunging rather than high-impact jumping, might not create that same differential risk for these types of knee injuries. It reinforces that fencing is a unique sport with its own injury profile, though they did find females had a slightly higher proportion of chronic/overuse injuries compared to males.
So, overall, what's the big takeaway for coaches and fencers, especially looking at the fact that 80% were treated with physical therapy, and only 5% needed surgery, with most having no time loss?
The most crucial takeaway is that fencing is, relatively speaking, a safe sport with a low incidence of severe catastrophic injuries. The majority of injuries are manageable, primarily through physical therapy and smart training adjustments. This means that focusing on proactive injury prevention, proper technique, balanced strength and conditioning, gradual increase in training load, and active recovery can keep fencers on the strip and performing at their best without significant downtime. Early identification and intervention for those nagging pains are key.
That's a great point, Sarah. It really emphasizes the importance of listening to your body and addressing discomfort early, rather than waiting for it to become a full-blown injury. For coaches, it means incorporating more targeted strength and conditioning, focusing on core and unilateral leg strength, and really drilling good lunge mechanics to build resilient athletes.
Absolutely. And this study gives us concrete data to inform those strategies, which is invaluable for a sport that has historically had limited injury research.
Thanks everyone for listening to Fencing Buddies podcast. This was a super insightful discussion. Until next time, keep your distance and stay sharp.